You've seen this one, your feed, your group chat, a confident voice, soft lighting, and a caption that reads, "Signs you might have ADHD and not even know it." 4 million likes, tens of thousands of comments from people saying, "Oh my God, this is literally me," and a nagging question, is any of this actually true? I'm going to walk you through the research, and I'll be honest, some of what I found genuinely shocked me. Here's a number that stopped me cold. 52%. That's how much ADHD content on TikTok contains misinformation. More than half. And autism content? 41% inaccurate or misleading. These aren't fringe videos. They're the ones going viral, the ones your algorithm is serving you right now. So let's do what apparently millions of people didn't. Let's actually check the claims. Let's trace the sources, and let's figure out why this matters so much. First, some context. TikTok didn't invent health misinformation, but it did build the perfect machine for spreading it. The algorithm rewards one thing above all else: engagement. Comments, shares, watch time. And emotional, relatable mental health content drives massive engagement. Think about what performs well. Someone confidently declaring, "You probably have ADHD if you do any of these 5 things." That's punchy, shareable, easy to watch. Now compare that to a licensed psychiatrist explaining that ADHD diagnosis requires comprehensive professional evaluation across multiple settings over time. Nuanced, accurate, boring. The algorithm doesn't care about accuracy. It cares about watch time, and confident-sounding misinformation keeps people watching. This brings us to March 2026. A major study drops, and the numbers are, well, they're pretty damning. Researchers analyzed thousands of social media posts about mental health conditions including ADHD, autism, schizophrenia, bipolar disorder, depression, eating disorders, OCD, and anxiety. Their finding? Up to 56% of those 5,000 posts were inaccurate or unsubstantiated. More than half. Just wrong. But here's where it gets interesting. Not all platforms were equally bad. YouTube averaged 22% misinformation. Facebook, under 15%. TikTok, 52% for ADHD, 41% for autism, significantly higher than every other platform they tested. Now, TikTok pushed back. Their spokesperson called it a flawed study that relies on outdated research about multiple platforms. Okay, fair enough. Let's look at other research. Here's another data point. On average, 45% of medical advice on TikTok was identified as false or misleading. That's across all health content. And alternative medicine content? 67% inaccuracy rate, 2/3 of it wrong. But perhaps the most striking number? Only approximately 2% of health content on TikTok aligns with established public health guidance. 2%. So what's actually happening here? Why is TikTok so much worse than other platforms? Let me walk you through the mechanics. The TikTok For You page isn't based on who you follow. It's based on what you engage with. Even briefly, even accidentally. The algorithm is always learning. Watch a 30-second video about ADHD symptoms. The algorithm notices. It starts serving you more, and suddenly your entire feed is mental health content. This creates echo chambers in minutes, not months, minutes, and the content that spreads fastest, the most confident, most dramatic, most relatable claims. Researchers noted something crucial. Mental health content on social media can encourage self-diagnosis without professional consultation. The same study warned this can lead to misidentification of conditions or unnecessary anxiety, people diagnosing themselves with disorders they don't have, based on videos. Let's talk about what this actually looks like in practice, because this isn't abstract, it's happening to real people right now. Psychiatrists have reported a surge in patients arriving with self-diagnosis based on social media. I saw a video that said, "This means I have ADHD," they say. Sometimes they're right. Sometimes the video helped them recognize real symptoms they'd missed for years. That's genuinely valuable. But sometimes they're experiencing normal human variation. Forgetfulness, distraction, difficulty focusing when you're stressed. Things that everyone experiences. The problem isn't people seeking help, That's good. The problem is a platform that makes confident misinformation indistinguishable from expert guidance. Real ADHD diagnosis requires evaluation across multiple settings: school, work, home. It requires ruling out other conditions. It takes time and expertise. A 60-second TikTok cannot replicate that. It wasn't designed to, but people treat it like it can. Here's what gets me. The creators making this content, most of them genuinely believe they're helping. They're sharing their experiences. That's human. But sharing personal experience isn't the same as providing medical guidance, and the platform makes no distinction, none whatsoever. This brings up what researchers call authority transfer. A confident presentation style triggers the same trust response as actual expertise. Our brains can't easily tell the difference. Good lighting, clear audio, relatable delivery, these signal professional to our pattern-matching brains, even when the content is completely wrong. So, what's being done about this? Actually, some really interesting things. Public health experts are fighting fire with fire. According to Nature, health experts have begun partnering with content creators to fight misinformation. Some of these partnerships have reached millions with accurate health messages. These science influencers are going viral on TikTok specifically to counter misinformation, using the same tactics: punchy content, strong hooks, but with actual evidence. It's working too. Duets and stitches that correct misinformation are gaining traction. The same algorithm that spreads bad information can spread good information, if it's engaging enough. But this is a band-aid on a structural problem. Individual creators can't fact-check an ocean of content. The platform itself needs to do more. Alright, so what does this mean for you? Scrolling your feed at 2 in the morning, wondering if that video is describing your brain? Here's what I'd suggest. Consider treating TikTok mental health content as a conversation starter, not a diagnosis. If something resonates, that's valuable information. But it's the beginning of a process, not the end. It may help to check creators' credentials before taking their word. Are they licensed clinicians with actual training? Or are they just really relatable storytellers? Remember that ADHD, autism, and other conditions require comprehensive professional evaluation, not a checklist, not a 60-second video, actual assessment over time. You might want to seek out verified health expert accounts that cite peer-reviewed research. They exist. They're just harder to find than the confident guesswork. And here's a big one. Be wary of content that makes complex conditions seem simple. Everyone has a little ADHD is a red flag, not a revelation. Look, I'm not saying social media is all bad for mental health awareness. It genuinely has helped destigmatize conditions that people used to suffer with in silence. Real people have recognized real symptoms because of videos they saw, and then sought professional help. That's a win. That matters. The problem is when the platform becomes the final word, when confidence replaces expertise, when engagement metrics determine what counts as truth. The pandemic drove a massive surge in mental health content on TikTok starting in 2020. By 2022, ADHD and autism content had become dominant trends. People were isolated, anxious, looking for explanations for why they felt the way they did, and the algorithm was happy to provide them, over and over. That's not nefarious, it's just how the system works. The algorithm optimizes for engagement, not accuracy, and emotional content engages. By 2024 and 2025, studies began quantifying what mental health professionals had been observing for years. The numbers confirmed their concerns. So here we are, in 2026, the data is clear. The problem is documented. The question now is, what changes? TikTok has added some health misinformation labels. They've partnered with fact-checkers. But with billions of videos uploaded, enforcement remains inconsistent. The irony is kind of incredible, actually. The same platform spreading misinformation is also hosting the people correcting it. It's all just content. If this kind of thing interests you, understanding how the internet shapes what we believe, hit subscribe. We cover stories like this every week. Because this isn't just about TikTok. It's about how we process information in an age designed to overwhelm us. That's worth thinking about. Mental health is complicated. Diagnosis is complicated. Treatment is complicated. Anyone who tells you otherwise is either selling something or doesn't know what they're talking about. That's not gatekeeping, that's just reality. Some things require expertise. Some questions don't have 60-second answers. So the next time a video confidently tells you something about your brain, consider pausing, note it, maybe write it down, and then bring it to someone who actually went to school for this. Your mental health deserves more than an algorithm's guess at what you want to hear. You deserve actual answers, even if they're more complicated. 52% of ADHD content on TikTok contains misinformation, 41% for autism, only 2% of health content aligns with public health guidance. These aren't just statistics, they're millions of people forming their understanding of their own minds based on confident-sounding guesswork. The algorithm isn't going to change overnight, but you can change how you respond to it. And that starts with asking one simple question: who says so? I'm Internet Mythbusters, and the next time someone says, TikTok told me I have ADHD, you'll know what questions to ask.